Hey guys, it's Dr. Lee. I'm recording for the addictions course. I hope everyone's doing well. I'm sorry for the delay in getting something posted. The quarantine is definitely starting to make its presence known now, so I apologize for not having something up sooner. Today, I'm going to go over interpersonal therapy for substance abuse. So, this will be a nice change from all the just strictly cognitive and biological aspects of addiction. This is going to sound probably very much what you envisioned when you told yourself, I want to be a counselor or some sort of mental health care provider. You probably used the word therapist, which is okay. But when you decided that you want to enter the field, this is probably how you envisioned doing this work. So let me dive in here now. Last week we went over CBT, the importance of cognitive distortions. And again, a lot of times with the theories, they are not either or. You are definitely welcome to draw from the different theories as needed. You can be eclectic. You can pull a tool from different theories. I'm pretty clear that I do dialectical behavior therapy. That doesn't mean I don't ever focus on cognitive distortions. That doesn't mean I don't ever do some sort of dream work and explore what the dream means to a client. It doesn't mean that I don't do solution focused things, right? You're pulling different tools. The thing though is knowing which theory is which and being able to articulate how you work with a client, right? And then also how do you explain um, different problems in a person's life? Why do people experience despair and angst and things like that? So definitely don't view these things as either or. I'm either in this category or that category, which in itself is a cognitive distortion, right? Black and white thinking. So last week we went over CBT and how to use it with addictions and substance use. Today we'll go over interpersonal therapy, and so this will have a lot of similarities with Adlerian counseling. So for those of you that enjoyed Adler and focusing on things like lifestyle, the family, meaning, the life tasks, things like that, that has a presence here. They're not exactly the same. Adler, I believe, came first, then interpersonal therapy came later on, but it does draw, in my opinion, very heavily from it. So we'll go over that and how it applies to substance use. So the purpose for interpersonal therapy is to solve interpersonal problems, which I know sounds like kind of a funky definition, right? Like interpersonal therapy, interpersonal problems, who didn't see that coming? But what the premise is that a lot of people's angst and despair comes from relational issues, right? That I have these issues or I have these deficits in this broader context of other people, in my relationship with other people, and that's what drives anxiety, despair, and in this case, substance use. And so the goal then for the interpersonal counselor is to help develop appropriate social skills to alleviate those interpersonal deficits. So just some broad strokes. We won't spend a lot of time here. Very similar to CBT, lots of focusing on cognitions and thinking. There is more acknowledgement of the feelings. It is time and goal limited, right? So you're looking at something from 6 to 20 weeks. Reliance on our therapeutic alliance. Always remember that your therapeutic alliance is more impactful than your theoretical allegiance, right? So I could be the world's premier cognitive therapist, but it will not do me any good if I don't have a good relationship with my client, right? So always rely on building rapport and establishing a healthy, cathartic relationship first. And it focuses on the development of skills, meaning we're going to practice here and examine where some deficits are, and then you, the client, will go out in the real world and apply them. Your personal functioning and your life situations are related. So here we have an acknowledgement that if you're in a tough situation, then you're going to feel bad. If your work is toxic, if your workplace is toxic, or you're in an unhealthy relationship, that is tied to your level of functioning, right? If you're look at right now dealing with COVID, there's everybody is struggling. If you are especially struggling, though, I have a sick family member. I've lost my job. My bills are due. Right, that is a very, very tough life situation. Then your personal function or your personal functioning is also going to diminish. Right, you're running yourself into the ground. Right, so there is this link, this connection between what's going on in your life and how you're operating, and that makes a lot of sense, I think. So the major issues that you face here kind of fall into one of four categories. Um, and again, I do want to make sure y'all understand that there is more flexibility than I might come across when I'm presenting. But largely, your clients will fall into one of these four categories. Complicated bereavement, which chances are you've heard of, and it's even mentioned in the DSM under depression, and it's not a diagnosis. I want to emphasize that. I'm going to go over it in a little bit, but this is not a foreign concept. Role dispute, role transition, and interpersonal deficits. For complicated bereavement, grieving is normal, right? If you have a death in the family, it's normal to grieve and to mourn. The reason I brought up the DSM is that it explicitly states under the depressive disorders that you should not diagnose depression if someone is grieving. However, it does acknowledge that there is complicated or complex bereavement where that death, that bereavement lasts longer, and there's no magic cutoff time, but it lasts considerably longer than would be culturally expected, let's say, or the magnitude of the grief interferes substantially more than we would expect. And so it's just like it sounds. It's from bereavement. I'm having a hard time healing and grieving and starting my life post death, right? Post the death of the other person, not my own death. Role transition. So just think of adjustment disorder, right? Whenever there's a major adjustment or change in a person's life and they have a hard time adapting to it, that's what's going on here when I'm transitioning roles. So it might be someone transitioning from being without children to being a parent, from being a high income earner to losing their job, from being able to do whatever you want to being in a much more restricted lifestyle, right? So moving for little ones, right? It's difficult to move, but where do I fit in this picture? Role dispute. So now we're looking much more at relationships. So when I'm arguing with my spouse or my partner or with family members, if there's like a power imbalance or a tug of war and we're trying to figure out who's who, how are we dividing up responsibilities, what do you want from me versus what are my expectations versus what do you want and what am I comfortable giving? So very relational. So all the arguing and relational or relationship type problems we would categorize as role dispute. And interpersonal deficits is sort of a catch-all, in my opinion, for if the person is struggling and they don't really fit into the other three categories. The assumption is that there's something missing in the person's life, that there's some sort of interpersonal deficit, meaning that the relationships they have are not very healthy or not very fulfilling. Maybe they're completely benign, but they're just not what the person wants. And you as a professional conclude, hey, this person's kind of struggling here. They're not really happy. This theory was really based around helping people with depression when it first kind of came around. And so it would be, that depression and those depressive symptoms would really alleviate if this person had better interpersonal relationships or had healthy relationships and skills, right? So, and we'll see some of that come back when we're talking more about substance use. So the first goals for interpersonal therapy and substance use is we need to have the client accept that there's a problem, right? And that kind of goes without saying. That's kind of what we've spent this semester talking about. Is the person ready to acknowledge that there is an issue, and also that they need to stop? Because someone can completely, it's completely possible for someone to say, yeah, it's a problem, but I'm not going to do anything about it, right? Managing impulsivity, right? Impulsivity it goes hand in hand with substance use and substance abuse, and recognizing the context of use and supply. So, in other words, helping the client understand when and why they want to use. And you can probably see where this is building up to. So the structure of your counseling, should you kind of pursue interpersonal therapy with someone, is very similar to CBT: an introduction, a middle, and an end. In the introduction, or those beginning sessions, we're going to pinpoint the problem. So in this case, for our class, it's substance abuse. We need to assess the severity. How functional or not functional has this problem made the person's life, right? And again, with addiction and substance use, we've talked about what type of care do they need. Do they need to do something more residential? Do they need to do the intensive outpatient? Can they do an outpatient counseling thing? But we need to assess the severity. And we also, now where we start deviating away from CBT, is focusing on an interpersonal inventory, establishing what are their current relationships like, are there any problems, what do they want, are they fulfilled. In your middle sessions, we're going to focus on the interpersonal target. So what is it that person wants from the relationship, or different relationships, and what's getting in the way? And we're acting as an ally here. We're not so much coaching, and we're not doing the power over thing, saying this is what you're doing wrong, but we are trying to establish, why is it that you feel that you don't get along with coworkers? Or why is it that you feel that you're always the last to know about social gatherings? Or what went really well when you communicated with your partner about what you want? And the ebb and flow of the counseling sessions would be reviewing last week, right? So tell me how last week went. I know we left off on this note of you were thinking about asking a coworker to go out to like shoot pool or something like that. How did that go? And we're going to review. And that's where you act as an ally, supporting them and encouraging them when needed, and then being there with them and kind of consoling them when they felt that they had difficulty. The easier way, I think, to understand this is that there is a relational context to this theory and the way substance use has woven itself into the client's life. All this talk about the interpersonal relationships inherently means that people want connection. So those of you that have studied relational cultural theory, it's very much that I want connection, and when I don't get it, I start to experience despair, dysfunction, and I start going to maybe some unhealthy lengths to try and establish the connection. So at some point, substance use can increase my ability to form those relationships, and it might be if I go to college, if I'm a younger guy, I go to college and I see all these social gatherings are going out to bars or going to parties where there's this drinking, or I learned that these people are my friends, but they stopped inviting me out when they go out drinking because I'm not a big drinker and things like that. Or we talked about the liquid courage aspect of it, the social lubricant. And so I use, and I'm saying drinking here can really be any substance, right? I do this and I might start thinking, hey, this is helping me make these relationships because I'm a fun guy, or I have the confidence, or I unwind. However, as that substance use becomes problematic, because remember, we're not talking about healthy use, right? We're talking about a point at which there is a problem, and this person or this person's family and loved ones are saying you have a problem. As it escalates, as the use becomes problematic, the relationships now start pulling away. So there's this element of diminishing returns, right? When I go out and I have a drink and I hang out with the guys, it's really good. But over the last couple months, I've been drinking really heavily, and now, for whatever reason, I don't have as many friendships. And if we had a way to tell, we, in this case, are thinking it's because you're drinking so much that you're unpleasant to be around. So the process of doing interpersonal therapy really has these two components. A formulation of functioning, so this is a little bit of detective work, and then change promotion. When we've hit our baseline, once we hit this formulation, we can then talk about change. So the formulation of functioning, very similar to CBT, right? So behavior serves a function. We kind of touched on this if you were watching my most recent trauma video, that if you've studied ABA or behavior psychology, all behavior serves a function. So what we're doing here is we're trying to figure out what is the function of the substance use. What does the person get out? And this would be more than it feels good, right? This would be more than I like the high of it. I feel more creative, right? Here we're looking specifically at relationships. So what do you want, and how does this substance use help you get it? And remember, I always encourage, look at the good and bad, motivational interviewing, right? We can't go in and just start saying, oh, well, those are all fake friends and things like that. No, if they come in and say, well, I want friendships, I want to be able to go out, and the only way I can do that is if I take a little something and that helps unwind me, that is the function, right? We don't jump in judging them saying, well, you need to grow a backbone and not do that. So one way of doing this, so here's kind of a technique thing that you can do, is gather detailed biographical information about them, right? Which is kind of what counseling is, right? But I might ask you, tell me about a time in your life where you felt really disappointed by someone. Tell me about a time in your life where you felt very supported by someone, right? And let's go into detail about that. What was it about that person? What was it about that situation? What was it about that context? And we might explore different memories, different situations. That's the really fun part. That's what you'll do in your treatment planning. I want to explore these different situations. Maybe it was, love lost, or maybe it was feeling left out, or feeling very popular and very liked. And as we start looking at these different memories, I'm going to start building a schema, right? Start just like we did with CBT. So what I might hear after hearing these different situations is, you are happiest, or you feel most content when you feel that you're kind of the leader of the pack. If you're not number one, then you're dead last, right? Or if you're not funny, people don't like you. And these are things that come up one way or the other. I had a client I worked with for a very, very long time who he's the funny guy, right? He was the class clown, and he had lots of friends, and both guys and girls, but he could not establish a romantic relationship because it's kind of like he would never turn off, right? He would never stop being the class clown. And he would say, well, nobody wants to be around me if I'm serious. Nobody wants to be around a serious person. That's my dog in the background. That's fun. Everybody needs a little bit of levity in these trying times. So we've built this schema of like what this person is aiming to do with their relationships and what they want. And change and promotion is after we've identified their patterns and their schemas. So with this client, what would happen is he would win people over with this charm and this lightheartedness. And then as his relationship, whether they were friendships or romantic, as they kind of grew, people would get kind of sick of them, right? And say, can't you ever just stop with the whole bit? And it was either I'm funny and likable, or I'm not funny and not likable. But in doing all that, he was pushing people away. So with substance use, it might be, I'm the party guy, right? I'm a silly drunk, right? Or I'm really creative when I smoke marijuana sticks and things like that. When I do this stuff, it pulls people into me, but now the diminishing returns. It's not working as much. So We've identified their schemas, the pattern of behavior. In substance use, it might be every time I get into a new relationship, best foot forward. We start drinking a little bit more. Now I'm drinking every night, and every relationship ends with the person saying, I can't be with someone who drinks or uses as much, and the cycle rinse, wash, repeat. So now we want to change that behavior. One of the things, and this is, now we're at the part where some of you, this is going to speak right to you. This is what you were hoping counseling would be, and I'm going to validate that, right? For the rest of you, it might be sort of like, I get it, but boy, that sounds a little confrontational. Remember, confrontation does have its place. That's why it's one of the basic attending skills. It's all in how you do it, right? It's in how you do it, how you time in, is it cathartic and productive and all that. So we need to help our client identify between fantasy, what they want and what they think will happen, and reality. And that can be really difficult. Accessing their strengths, right? So the strength-based approach, the positive psychology approach, and what do they do that does work, right? Focusing on different like things like resiliency and creativity. And we want to find a way to obtain desires. Now, here's the rub. Some people want things that they cannot have, right? And that's really difficult. And this is where I encourage you to remember what your role is when working with people, is that you're not a friend, you're not someone who's just there to pat them on the back and say, yeah, maybe, or to make them feel good. It can be a case of someone wanting to say, if I could just, I wish I could have one more conversation with my father who passed away. And I'm not suggesting you be heartless and say, well, that's not going to happen. But it is saying that would be nice if we could make it happen. And we can't. So what else can we do to kind of get that same feeling or that same validation, right? So accepting what cannot be and finding maybe some way to close it, right? It's not just, that's not going to happen, let's move on. This is where I say confrontation comes in, right? I want to do this, but that, right? So you're there saying, right, but this is getting in the way. You can't have both of these things, right? You can't keep doing what you're doing and have the relationships that you want. They're interfering together, right? I kind of give this example every semester where I work with college students and they say, I want to go to grad school, I want to go to law school, I want to go to medical school, I just want to graduate. And they skip all their classes and they get in trouble. They're going to the dean's office every day, all sorts of problems. I want to be a professional athlete. But they're using all the time and it's showing in their performance, right? Well, here's your fantasy, right? Here's what you want and here's what you're doing, and the two are not connecting, right? So then we start working on what needs to happen to pull your behavior in a direction that's consistent with what you want. This takes time. Right? Nothing in counseling is ever fast, right? That's one of the things that I wish I would have known going into the profession. You'd think it'd be common sense. Maybe it's because there's all these TV shows like Law and Order and House and stuff where someone has a very serious problem and then, in the next scene, there's some sort of result. Change takes time. It takes a lot of trial and error and things like that. There's going to be discomfort in the client. Like, it's going to be uncomfortable for them, and it's going to be uncomfortable for you too when you're confronting saying, you can't have some of these things, right? And again, I don't suggest saying it that way, but as you confront and they're saying, I just want this, this is the only way I can cope with the day, right? And that's not a sustainable way of coping, right? That conflict for some people is really difficult, and that's okay. There's other ways of working with it. I still think it's something everybody should experiment with and develop that skill for when you need it. Confrontations will be your most utilized skill in this. And again, just like with CBT, because this in a nutshell is a person wants certain relationships, can't get them, so they use. And if we find a way for that person to rectify or improve their relationships, then they won't use as much, right? That's kind of what this is in a nutshell. And maybe there is some truth to it. If I fix the context around me, my angst and my despair lowers, and so then I don't think about using as much. However, just like with CBT, you still have those biological issues where you can have the bodily cravings. Your brain is screaming, give me something. You're going through withdrawals. You have the tremors, you have the headache, you have the lethargy, you have all that stuff. So you can still crave and do all that. And so that's still something that you would have to contend with. This isn't a, hey, make some friends and boom, you're not using anymore. But the emphasis is on a lot of motivation to use comes from the lack of relationships or having unfulfilling relationships. That's going to do it for today. I hope that was useful. If you have any questions, let me know. I'll post a few articles for everybody to read. I'm going to do probably one more video for the semester. We're right at the end. For the summer, as you all know, summer classes will be done online. My classes, if you're in either my diagnosis section or assessment section, they will be asynchronous, meaning that we will not be meeting live or in real time. It will be kind of a at your own pace type class. However, I'm still open to meeting for virtual office hours through Zoom or by phone call and things like that if anybody needs anything. I hope each of you are well, and I will talk to you again soon. Bye.